With 13,000 members training and teaching hospitals across the country, CIR is all about making sure the resident physician voice is heard loud and clear. From advocating for our patients in hospitals to expanding educational opportunities and building resident community, this year has taken us to places we've never been before.
October 28, 2012, Superstorm Sandy hit New York, New Jersey, causing devastations and disruptions to millions. But CIR residents and fellows rose to the occasion, providing compassionate care under complex conditions.
Sunglasses make everything cool, especially quality improvement, and CIR is helping to lead the way. The CIR Policy and Education Initiative partnered with Cornell University to sponsor What's Your QI-IQ, a conference in New York on resident leadership in quality improvement and patient safety. In the Southwest, CIR members at the University of New Mexico not only negotiated a quality improvement fund into their contract, they also published the Journal of Quality Improvement in Healthcare for the second year in a row.
Why do resident physician report so few adverse events? To figure this out, residents at Boston Medical Center conducted a study. In Miami, after 5 years with no contract, CIR members not only ratified a contract providing raises and protecting benefits, but get this, they also negotiated a community outreach fund of $125,000 paid by the hospital each year. Residents at Highland settled contract negotiations, resulting in gains for all PGY levels. Residents also negotiated a $15,000 diversity fund.
Wherever there is injustice, no call for advocacy has gone unanswered. Residents this year helped win paid sick days in New York and fought for them in Massachusetts, continue to provide international medical relief in Haiti, and lent their support to the fight for better gun control, immigration reform, and health justice. CIR to the rescue! In New Mexico, members joined others around the state in favor of Medicaid expansion. Not only did residents speak out, they danced out, sending a message to Governor Susana Martinez to urge her to accept federal funds for Medicaid expansion. And guess what? We won!
Today, we can have healthcare for everyone. Today, we're dancing for the right for our health.
After a 3-year campaign in New York, CIR members were part of a successful effort to pass a paid sick days bill. It was an important victory that will allow about 1 million New Yorkers the right to paid time off. In New Jersey, CIR doctors joined forces with the Newark community to stand up against cuts to Medicare and Medicaid.
But my vote is not to cut Medicaid. So I hope that you know that your doctors are here with you in your step every day. Thank you.
And how could we forget elections? Boston CIR members worked with members of AMSA to register over 150 voters, and CIR members from across the country celebrated the 3-year anniversary of the ACA.
No one should have to choose between putting food on the table or buying their medication.
Not only did CIR see wins in the national election, but our 2 CIR-endorsed candidates won in New Mexico. This means more champions for health care and the safety net in Washington, which is always a good thing. Senator Gustavo Rivera of the Bronx's 33rd District got a second CIR endorsement because of his commitment to securing a healthier future for Bronxites. Way to go, Senator!
Across the country, residents have stepped up. CIR continues to provide leadership in health justice.
But it's important enough to know that there are a lot of transgender people out there. So now we kind of have an idea of how many transgender people there are. So let's start talking about some of the, issues. Why are we worried about transgender care,
Hooray, CIR! 2013 has been a great year for developing physician leadership. From our Healthy Bronx initiative, CIR partnered with community organizations for another round of family health challenges. In San Diego, CIR hosted its first ever Women in Medicine conference. Check out what residents had to say.
People always call you nurse. I'm like, hi, I'm Dr. This, and they go, hold on, the nurse is here. I'm like, no, I'm the doctor. I said I was the doctor, and I can't tease out, is that because I'm a woman? Is that because I'm young? Is that because I'm black?
Thanks to collaboration with CIR, the Telluride Patient Safety Summer Camp hosted 20 resident physicians this year. Residents were so excited about bringing patient safety projects back to the hospital, One of them actually wrote a song about it.
Learning about patient safety in the mountains. God, I love this place. Effective communication skills.
Saving the world was not an easy job this year, from West Coast to East Coast, but CIR members made it happen. And we had fun with it.
Learning how to save more lives.